I'll start over. Welcome, everybody. And we're really excited to have this topic talking about electronic medical records. I know all of us have been, the last 18 months or even more, have been working in Haiti, loving Haiti, dealing with crisis after crisis. I always say another day, another fight. I probably need to get another motto. But that's just how I've been feeling lately. And I was really excited at one of our recent Haiti Health Network meetings where we had, I think I'm going to give Meg credit from Hope for Haiti for bringing up an idea of this topic. And I love that we are talking about something that is not life or death at the moment. I'm happy about that. I mean, I don't want to forget about the life or death. I'll be back in it right when we're done with this. But I think there's something about the normalcy of talking about this. And I want to, we're designing this to be a discussion. That's why we didn't set up as a webinar, but we do have several speakers that are going to share with us directly. And I want to introduce them all. So we've got Meg Jean-Louis, who's here from Hope for Haiti. And I know they've been through an extensive process to get an EMR, and they're going to share their wisdom. We've got Lindsay Noel Sosa from Danita's Children Medical Center up in Wanamint, and they've gone through the process to get one. We've got Rasha Yehi here with C2C, who runs and operates several clinics up in northern Haiti. They've been through the process as well. And then we have Lori Most with us as well. I think many of you know Lori. Lori's runs Backpack EMR, and they do EMR solutions. You know, I'll let Lori explain it way better than me. But in Haiti, they use it a lot in Africa. It's designed to be in a Haiti type environment. And so she's here to share as well. And then again, like we said, we'd like to hear from all of y'all. So what I was thinking to get started, if it's okay, we'll just go around. I'll have each of them share a little bit just regarding just the question or the thought, or we'll start with you, Meg, if that's okay. And then we can go on to Lindsay, Rasha, and Lori, no particular order, but just how y'all are on my screen actually at the moment. Of kind of just how you started the thought process and what are some of the things you thought through when it went to considering getting an EMR for your healthcare facility. Meg, I'll turn it over to you.
Sure. So hi, everyone. So as I said, I work at Hope for Haiti, and just give you a little bit of background. We currently have a medical team of just around 100 medical providers who see 100 to 120, who provide 100 to 120,000 consultations annually. This is at our clinic, which is a stationary clinic, and through mobile clinics. We started our process in 2014, actually right when I joined the organization, and we were working with a company in Bangladesh, and it was kind of handed to us through a donor. So we really didn't have a lot of say as to whether it was a great fit, but it was recommended through a donor. So we started with them, and ultimately what it came down to was that it wasn't out of the box. The customer service was, as you can imagine, just being in different time zones, was very challenging, even with the best intentions, was hard when we were working in different time zones. The ease of use, it was very difficult to use, and the price was expensive. So all of those things were our challenges, but they're also the things that we looked at when we were considering an EMR. So after about a year and a half of trying to implement that system, 2 years. So in 2016, we started doing a desk review, and that's really when I jumped into my love relationship with EMRs. I mean, I feel like I know everyone here on the call. It's so great to see you all, Lori. We spoke so many times. I did so much research, and we did desk reviews, we did partner reviews. So we talked to partners in Haiti. We looked at organizations in similar size and scope, globally, and what they used and what worked with them. At one point, the Haiti Health Network that the Dalton Foundation runs, they actually highlighted an EMR system on one of their Facebook pages. I don't know if it was the main one, it might've been the EMR user one. And that is actually the system that we're using today, which I can go into in some later conversations. But so again, for us, the key things that we were looking at were, is it out of the box? Because we know as a nonprofit, we don't have a budget for developers for ongoing changes, customer service. Well, if there is a change, are we going to be able to reach someone? Ease of use, and then the price. So those were the main things that we had looked at.
Okay, great. Thank you for sharing that. I love hearing from y'all because I've known y'all for so long, and I've known when you started the process, Meg, and how much thought and time. It's a big investment for an organization to bring in an EMR, and I think you said something that I can really relate to too. Is like, you're not an EMR expert. It's not like you majored in this in college and know exactly what you're doing. So it takes a while for us to learn. And I know I've been in that position so many times over the years of like, how do I make a wise decision when I know that I don't know enough to know all the things I need to ask? So that's a good ways to think through it. Lindsay, I'm gonna turn it over to you and share a little bit about what you've been doing at Danita's.
Yeah, so our process has been a little bit different of how we came to choose what EMR we wanted, but I think ultimately it's probably the same frustration or need that everybody has. And I mean, a lot of it came from, my boss who said, hey, we can't have this huge storage room of thousands and thousands and thousands of charts as we continue to grow. And we already have thousands of charts, but how can we minimize this and be more efficient, obviously, with our care? And as Rachel had said earlier too, a lot of time it's really frustrating when patients come to the clinic because they may have a chart, but when they come in the second time, their name isn't spelled right, it's a different person, they don't have the card we've given them, so all those challenges. But we had looked at a lot of different EMRs. I don't know if I did as an extensive research as probably Meg did, but the ones that we found didn't really fit with us. But we had already been working with this company called Worldwide Lab, and they actually are a nonprofit organization that actually helps get labs up and running in developing countries. So we've been working with them for 6-7 years just on our laboratory. So if you want to do another session on lab, I will definitely promote them. When you said customer service, Meg, that is my number one for them. They've always been there. I mean, they'll troubleshoot with me over online, even when I don't know anything about the lab. So they've just been great. So I think that rapport and relationship I had with them really kind of sparked more of my interest in what EMR they had. And so they actually had developed their own EMR, which is called Worldwide Lab Software Solutions. I just call it our EMR. But what we were looking at when we chose them were some specific things. One, it had to be an EMR that was available in French, because I'm the only American that works in the hospital. French or Creole, but most of the time you're not going to find an EMR that's available in Creole. So you want to at least try to get one that's in French. So that was one of my top needs, was for our staff to be able to use that. The other one was, can it function if our Wi-Fi goes down? Which obviously, even trying to get on the call today is like, is my internet going to work? So that was huge. Also, it had to be a system that, for the most part, incorporated the programs that we already had in the hospital and also could grow with us as we grow. And in our facility, we don't just have an outpatient clinic, which I think a lot of EMRs that I looked at were really great at doing an outpatient clinic. But overall, is it able to encompass accounts payable, the emergency room, OR services, potentially inpatient services, and obviously like lab, x-ray, all those things? Could we find one to encompass all that? Now that's a big ask. And of course, no EMR is going to get exactly what you want. But a lot of things that I found were, okay, yes, you can find one that is doing outpatient, but they don't do accounts billable. Yes, they do outpatient, but they don't do this. And so I think that was really kind of sold us on the program that we have now. So it had to be in French, could function without Wi-Fi, and then could incorporate most of our programs and then grow with us. Those are our main things when we decided to go with the program that we have.
All right, thank you. Thank you for adding those additional points. That's very helpful. And obviously you guys too have a special need for kids. I don't know if there's different things when you think about children, but being that that's your primary focus, that's a huge piece of it, I'm sure. All right, and I realize I gave the order wrong. So I think Lori, you're next, and then Rasha. So I apologize. I got out of order. But Lori, go ahead.
No worries. So my journey with EMRs started back in 2013. So my background is very different than probably everyone on this call. I'm on the software side. So I was in software engineering, but went with my sister. She's the physician assistant to do some surgeries down in Peru. And that's where I saw the problem or the issue of needing an EMR. And just like what everyone has said so far, I was looking for something that will consolidate the patient information, that it would be available to kind of cut down on all the different pieces of frustration with paper charts. And I actually downloaded multiple EMRs. So I tried Practice Fusion. I think we looked at Mac Practice. I downloaded OpenMRS. There were multiple other EMRs that I tried to look at as well. And unfortunately, none of them were going to work for exactly the scenario. I think Lindsay, you had mentioned too, like you have to find exactly, we were looking for orthopedic surgical and we wanted it to be fairly slimmed down. We wanted it to also be in Spanish. So there was a language piece there. We didn't have consistent internet. So none of the cloud-based solutions were going to work. And then we also didn't have electricity in the rooms that we were in. So we struggled a little bit there too. So as far as the EMR concerns go, those were kind of at the top of our list, and why I decided that we should just try to create a new one, right? And so that's how Backpack EMR started. So I can go more into Backpack EMR later, but just from answering the question of considerations, those were the considerations that we had. So I would just echo the same thing that Meg and Lindsay said.
Thank you, Lori. And I know that both Lindsay and Lori, both you have a couple slides to show the EMR. We'll do those next. So I want to hear from Rasha at C2C, and then we'll have Lindsay show a few slides, show an example. We'll have Lori show an example, and then we'll probably go to Meg and Rasha on some lessons learned, if that just a little outline of where we're going here for everybody. Rasha, would you like to share a little bit of your story at C2C and the process with EMR for y'all?
Yes, sorry, my internet is really bad, so I don't know if everyone hears me.
Yes, we do.
Okay, so I'm just going to keep the camera off. We started with an EMR system back in 2012, but we had a closed system, so not an open source. And that's how we started. And then we started getting more and more clinics and seeing in more patients. With an open source, with a closed source EMR, you're not able to play with the reports. You're not able to change too many things. It's very restrictive. So we wanted to move out of that. And because we were getting more and more clinics and more patients, it was just not the right fit for us anymore. So we went searching for another EMR system where it could be an open source. It can, because we have a kind of like a pharmacy, we have the lab, and we have the consultation. So every department needed something to be answered. So right now, we wanted something mobile, because if it stops working, we can bring it to the office, we can plug it, and then they could fix it for us. Because with the other one, we had a lot of issues with the system. So we ended up going with Mecom Solutions, and they're the same provider for Milo as well. And we picked 3 systems. So they created this prototype for us, which is an appliance. And in that appliance, we had Bahmi for our consultations, Udo for our lab, for our pharmacy, and OpenLS for our lab. So those 3 systems at the end connect to Bahmi, which is a little complicated, but everyone can see everything back on Bahmi, which is the main OpenMRS system. So we started the implementation almost a year ago, more than a year ago, but we've been working on how we wanted the system, how we wanted the consultations. We actually also put the MSPP report on it, so it can automatically tabulate everything of the statistical report for the government. It also has registries, though they can be printed right away. So it was kind of like to what fits our needs. And that's it for now, I guess.
Sorry about that, I'm muted. I like hearing all your 4 different perspectives of how you came at this. There were some similar things all of y'all said, and then yet there's some different things that help bring in the picture. So I hope that's helping everyone that's listening and hopefully helping formulate some questions. Rachel, I think you have some slides that shows the EMR that Lindsay and them have gone with. So maybe you can pull those up. We could share those. We'll share a little visual on Lori's. And then I think one of the best questions that we can hear everybody answer is, tell us what the lessons you've learned. So we'll save that for last because I think that's where we can help people avoid mistakes and things like that. So first we'll let Lindsay go through the EMR that they have.
I'm just gonna really go super quick just so you guys kind of give an idea of what this is. So Rachel is gonna be going through, but basically this is what it looks like when you log in. You can go to the next slide already, Rachel. So when you go in there, aesthetically, I'm not as pleased aesthetically how it looks, but functionality is sometimes better than how it looks, I guess. So when you get in, the top bar that says patient lab, and everything, those have a bunch of drop down buttons. So it depends on who's logging in. So I'm actually the main administrator, so I'm gonna have every single option as possible. But if you're logging in as a lab person, you're only gonna have the lab option. So it definitely sizes down depending on who's actually using it. You can go to the next slide. So basically, you go in, you create a patient. This just shows what it is. And I'm going to talk about my challenges with this because we're kind of coming in. We actually have not gone live yet. We're going to go live in a couple months. So I've really just been working with the programmers to get everything ready to go live. But this is what it looks like to create a new patient. Go ahead. The patient vitals. And keep going. I'm going to try to go a little faster here. So this is the main screen for the physicians. When they, your process to go in through the hospital, the nurse is going to do, the registration is going to create the new patient, the nurse is going to do the vital signs, and then it gets to the doctor. So they're going to be able to get on here and enter in all the information as if you're doing like a paper chart. But at the bottom, this is where all of the information that the doctor can access if the patient actually has some of those things already in their record. So you would select the patient, all the data would show up depending on what visit it is. You can go back to past visits, etc. Next slide. So at the bottom, this is what I really like. So this is the same page, but just scrolling down to the bottom. So I picked this is not a real patient, so not real results, okay? This is just a test patient. But at the bottom, if the patient has new test results, there's gonna be a little red asterisk. So I really like that for the physician. So if they're getting into a patient and lab has already put in their data, they can just go there. They can also request a test from here. There's a lot of things that the physician can do from here. So if they also order a prescription, then they can do that from here as well. Next slide. Next slide. Yep, there you go. This is kind of what it looks like for requesting a test for lab. Again, all these are just blank because I didn't pull up any patients. But it's pretty user-friendly, I would say. I mean, on any EMR, there's going to be a lot of different things, so you really have to do training, obviously, with your staff. But this is what it looks like for lab. Next. Next slide. So I'm going to talk a little bit about my challenges with this because with this program, you have to build it with the builder. So all of this is already built, but you have to customize it for what your clinic is, which I think would be across the board for any EMR. But they obviously have options to go in to change the names into Spanish or French, or any other language. Next slide. Again, this is another time-consuming thing, is for all the labs and anything you put into the system, you have to do that manually. So when you go in to put your regular labs, most labs are going to be on the fairly the same, but sometimes per machine or per facility, they're going to change a little bit. So this just gives an example of how you would go in and actually put the ranges for the labs. Next. Again, here's the x-ray request. Next slide. Again, going in and adding the different languages, which you can see I have not done all of that yet. Next slide. So this is what it looks like. They're all very similar. So to go in and do a prescription, you would go select the patient, and then at the bottom, you would then select the medication. Next slide. I really like this system because it does incorporate all aspects of the clinic. So pharmacy, lab, x-ray, accounts billable, and things like that as well. So you're going to be able to have a master inventory of all of your drugs and then be able to inventory it. Again, at the beginning, or if you're purchasing every month, you're going to have to put in that number manually, but then throughout the month and at the end of the month, you're going to be able to see how many meds you've used, how many you have left, etc. Next slide. This is what I really liked, because as a former bedside nurse, I wanted something that would be able to help incorporate our inpatient, which is really challenging because there's a lot to be, you need a lot to be able to do inpatient. So the one thing it did not have is an electronic MAR, which if you're an inpatient nurse, you'll know what that is. And so that was like my big wish list that this had. However, this is called bed management. And so we're able to actually place patients in certain beds depending on what their status is. Obviously, if they're outpatient, they're going to get quote unquote discharged that same day. But if they're inpatient, the nurse can actually electronically put them in a specific bed. I think for me as an administrator, I really liked this because I get a lot of referrals from different facilities, and sometimes I have to contact the physician, go up to the floor, see how many beds we have available, how many are open, etc. So hypothetically, if this is done correctly, then I would just be able to log in and say, okay, we have 2 beds, we have space. So I really like this aspect of this EMR. Next. Also, part of the bed management is that at the bottom of each, so if there's a patient in this bed, there's these 4 little squares at the bottom, and that actually then tells the nurse if they have a specific test. So there's a lab results, ultrasound, x-ray, and then prescription. So if there's a new lab, obviously, then this will highlight in that pink color, and then the nurse will then know, it's a typical EMR, but I really liked this aspect of it to be able to implement the same system hospital-wide. Next slide. Again, like I had said before, we're able to do accounts billable. So another step in the beginning, obviously, is then putting in all your charges. So lab charges, x-ray charges, all your medication charges, everything once they're in the system, and we start ordering labs, we start ordering x-rays, whatever is done in that particular patient, then once they go to the cashier, then they will have the total amount and then they can pay. Next. And then the last slide is just, its ability to run reports, which I think I really enjoy as an administrator, because as of right now, a lot of us I know with, our NGOs and other programs, we have to produce certain statistics for NGO reports and things like that. And a lot of that's done manually right now, which is very challenging. You have to keep up with it. So once we have more data entered into this EMR, then it can run a lot of different reports for us, which is really helpful. And that's it.
All right. Thank you so much, Lindsay. I can definitely see that that is very straightforward and user-friendly. And I've known the guys from Worldwide Labs for a long time too. I honestly didn't know they had an EMR though. I've used them for their lab
Yeah.
services. So I learn something new every day for sure. Lori, you want to go ahead and do a few little sample of the EMR that you have and the features?
Sure. Yeah, no problem. I'll do this really quickly. I'll zip through a few because I know this next phase is going to be pretty fun for people to talk about challenges and questions to ask and things. So this is just a really quick snapshot of our EMR. So it's, on an iPad. I'm just, transcribing it onto the screen. But it was built for simplicity. So we initially started with mobile clinics, like I was talking about with the orthopedic surgical unit, but then we've also sort of transformed more onto the primary care side. So we started to do mobile clinics for primary care. And then as COVID hit and we started to see more of the unrest happening in Haiti, we moved more towards permanent clinics as well. And so we've started to add more things that are used for permanent clinics. So you'll see some of that as we go through. And then we're starting to add more and more around things like inventory management and billing. But if you come in here, we've got all quick users on there. We're very photo enabled. You can see that all the patients have pictures and things on here. As you come through, these is just our test environment. Once you go into a patient, you can see all the different visits they've had and what types they were. And then you can kind of really quickly snap through their visit and what happened during their visit. You can see we've got orthopedic in here as well. So you could have surgical visits. You could do just general surgery. We did add inpatient here as well. Let's see if I can click on that, where, you can keep track of vitals ongoing and ordered labs and things, fluids, treatments. So there is the ability to do that as well. And then we do also have something called queues, which is a little bit similar to the bed structure that Lindsay was showing, but it's more like a clinic flow through your station. So as you move through the clinic, you could move patients into these different categories, and then you can really see where everyone is. So you can see we've got 2 people waiting in vitals. You can see how long they've been waiting there. And those are all customizable. So you could we've got one hospital in South Sudan who is using the inpatient module and uses those queues for their beds or their rooms. So they've got certain rooms and you can always see which ones, how many are in each ward, those sort of things, is one option as well. But like I said, I just wanted to kind of zip through that. This is at a very high level, how to use the system. Like I said, it's fairly straightforward as far as usability. It is in any language that the iPad has as well. So we do have French and Spanish. We don't have people using too many others of the languages. But those are the primary ones. You can put yours in one language and someone else's in another. And it does work completely offline too. So all the different tablets will talk to each other while they're offline. And then you can upload it to the cloud. So you can then also do remote patient chart reviews and things like that from the States or from an urban center, those sort of things as well. So that's just a super high level kind of overview of Backpack EMR. Just so you can kind of get a quick feel. And if you want to see more, let me know. I can definitely walk you through more as well.
Yeah, I know it's got a lot of functionality and you've added a lot to it. And I know you do have several clients in Haiti that are using it too, right, Lori?
We do. Right now, we've got about 40 groups using us now, and about 10 of those are in Haiti. We are across 24 different countries, so we have quite a few in Africa as well, and a little kind of cluster in Honduras and Guatemala and Ecuador. But Haiti's probably our biggest right now with 10 there. We've got a couple people on. I know Bethany. Bethany's on here. Yeah, Bethany was one of our early adopters with Mission Haiti. So their clinic has been using us for almost 4 years now. 4 years. So that's been a while. And then we've also got Soaring Unlimited. Yeah, so Brooke's here. So they just started implementing as well. So yeah, we're starting to get a little bit more widespread in Haiti.
That's awesome. All right. I love that we have so much diversity here with the different systems. So I wanted to go back to Meg, if that's okay, and ask you, Meg, if you would like to share with us. I believe you've launched now. I'm correct. You've launched now, right? And so you've got some history, and I know I mean, all of us have done EMR launches probably here in the US even, and you know how painful it was. So I just would love to hear, from we've talked about the things you thought through as you chose it and developed it. What were some of the implementation challenges and or lessons you learned once you started rolling it out?
Yeah, that's such a great question. I think the biggest thing was the learning curve of our users, and not that, I mean, our team is very tech forward, but using a system and understanding what the business rules are. So kind of our internal processes and procedures for, for example, like in the doctor notes section, like how are they shorthanding things? Are they, standardizing the comments, standardizing the notes, or what's the flow, who inputs what? I think that there was a lot of questions, because ours is, it's out of the box. While we can make modifications, those have to go through like a full edit. So a lot of like, I just want to change this to this or that to that. So there was a lot of, I think, just our business rules is the term I always use to describe that. This system, and I wish I should have shared it too, because I love seeing your systems. We have 18, I just looked, we have over 18,000 patients registered, and
Wow.
we have over, I think it's like in our pharmacy, the system comes with a lot of like the medications, medical supplies, for the pharmacy, for example, or the inventory already preloaded. But we have a lot of user error where like albendazole is spelled 3 different ways. It's albendazole in Creole with like the so it's all, so like those kind of like that's set up, like doing the addresses. So it's a lot of the, and our developers, they went in and they like sent us like, here's, some things you should fix, all normal stuff. And I think, it's just that learning curve of, how do we create an address? How do we input this? What goes where? So that took a long time. Clearly I'm not in Haiti. Well, not clearly, but I'm not in Haiti right now. When I was there in 2014 and I was like in it, I was like championing it with like our EMR person, and it was great. It was like all hands on deck. So I think I was going to say like, this is probably jumping to the next one, but it's also part of key things to consider. Like the team has to be on board. And like, there definitely was a shift with our team. I think a lot of it was because of the pressure we were getting from MSPP that you need to be digital, you need to get organized. So everyone is on board now. And that's one of the best things that helps mitigate the challenges, but it's still challenging when you have almost 100 people using this system. So definitely the learning curve. While I do think we invested in training, there's always more training that can be done. I think, learning sessions. So I would have, if we were just starting, I maybe would have put more emphasis on that. We're 18,000 people in. So, we're still young, like that's still only like, 20% of our patients we see annually. So there's still room to grow. But I don't want to get too far where we're, there's a lot of, data that needs to be cleaned up. Some of the other two other challenges, one, it was like our clarity, and this is so particular, but the clarity around paper records, like to keep or not keep, for the long time, we were still, everyone's shaking their head. Yeah. For a long time, patients were still walking around with their paper records, their folder that has a big diabetes on it. And we're like, all right, you got to stop that, so I think that was a big challenge, and it still is, because we still are, there's still not a lot of clarity. Like we're like, how long do we have to keep them? We get different answers. So, and then if the internet does go down, yes, this works offline, but there's still that fear, because not even fear, it's a reality of our medical staff. They've been doing this for 10, 20, 30, 40 years, and they've never had a system like this. So I do think that, that's the habits that we'll have to get into. And then lastly, biggest challenge in implementing this is MSPP reporting. Someone mentioned that their C2C, that system can, I actually popped a question in there for you. You still have to handwrite. So yeah, that's the other biggest challenge is, I'm talking to my team. I'm like, this is such a great tool for reporting for donors, for, our nonprofit donors, but we're still held accountable by MSPP, and we still have to have that one person writing in that black pen, same, handwriting, that little book that gets sent in. So there also still is this like, is this the greatest thing when we still have to do these MSBP things. So I'm just saying MSBP, I think is a challenge, not that we're not filling out the forms, but we, you know, our syncs with DHIS2, we are in talks of developing a report that would populate that literally matches the MSBP report that we can just, you know, it would roll up and then we print it out, but MSBP won't accept that yet, right? It still has to be handwritten. So I think that's going to be an ongoing, I don't think that's particular to ours, but that's still an ongoing challenge that, you know, some of the feedback I get from my team. So those are the four challenges, I would say.
Yeah, you brought up some excellent points, Megan. I know that I've seen that visiting a lot of clinics too, of the rolling it out and then still having to do the manual side by side. And that just, I don't know, it's going to just take time for everyone to move over and fully adopt the new system. But another things I really wanted to highlight that you said that I thought were really important too is the kind of like the soft skills or the importance of change management of just because we're, you know, we understand the benefits of having this EMR. It's change and it's big change and it's asking people to do things a very different way. And it is very difficult. I mean, if any of y'all have lived through it here in the US, you know, as a healthcare provider, your 8-hour day suddenly became a 12 or 13-hour day while you were adapting to it and you wanted to like throw the computer against the wall for a while. And so you can imagine as you're doing that in Haiti and there's a language barrier. We've been doing it this other way and it's not been that bad. Why are we doing, you know, there's a lot that goes into launching something like this to help everybody understand the value of it. So that's a really important point. So I know, Rasha, your internet dropped out, but I believe you're back now. I had asked Meg the question and I'll ask you if you can hear me as well. What were some of the lessons you learned as you rolled out, or maybe some things you might do differently a second time?
Yes. I don't know if my internet's working right now, but I think as Meg said, the biggest challenge is, behavioral change. So, the staff was used to an old EMR system. Now we're getting a new EMR. So they were always comparing, contrasting, and, they needed to have fresh eyes and have a positive attitude when they're learning something. So we needed to hire an EMR IT technician to overshadow, to be there to support them. There was a lot of training. We would do a lot of practice. So the first 2 weeks we would just practice, and then just erase everything and restart. So it's just you needed to answer the question. We asked their opinion about the system. How do they feel? And what's nice about an open source system is that if you don't like something, we can change it. So, at the beginning, we were a lot of our employees said, why don't we put nicknames? So right now we have nicknames, so you can identify a patient as with their nickname. In the old EMR system, if a person had an accent on their name, we couldn't recognize it. Now it doesn't matter if they have an accent or not. We can recognize the name. So it's more versatile, and we're just waiting for the analytic part to it so we can analyze. So everything goes onto a cloud, and then our employees will go on a weekly basis, do a backup, and then everything will be put on a system called Superset. And this is where we can analyze all our data, because donors want to know, are patients getting healthier? And we want to track this data, and we want to track our health indicators, and it's much harder to do on paper and pen. So the issue with us, I think, it's the whole appliance. The system works, but it's the appliance, because they created a specific appliance for us. So it's not like we didn't have a big room, a big server area. So it's a very small prototype that is very mobile. It's like a small little briefcase. So similar to what Lori has. But the system itself is heavy. So Bahmi has like 41 extra steps when it opens up. So it takes 15 minutes to open up. So I think we're probably going to change the appliance, but stick with the same system. So we are discussing different appliances for now. So that's the only negative part right now for us.
Yeah, that's something I really wouldn't have thought of. I mean, Lori, I'm sure, has thought of all those things, knows all about that, but I wouldn't have even thought about that. So that's a really good thing to think about. I wanted to
Barbara,
turn it
can
over.
I ask a
Yeah.
question?
Yeah, I was gonna turn it over to y'all next. Go ahead.
Okay. Oh, all right.
No, go ahead.
It would help me to know more about the organizations that are using it. Like, for example, if is Hope for Haiti a hospital, or is it multiple clinics, or what is your setup? And also C2C.
Yeah, so we have a primary care clinic in the city of Lakai, and then we have mobile clinics that operate in about 4 of the southern departments.
So you use like iPads when you do your mobile clinics, and it's on the iPads?
Yep, Surface tablets.
Okay. And C2C?
So we have clinics in partnership with the Ministry of Health, and we have clinics all over rural areas of the north, and everyone is using it on a tablet. So it's a off the grid open source system, and then we do backups, and then we connect it to a cloud server, and then you can see all the data.
Does anybody else have any questions for any of the presenters? Bethany, maybe you have a comment about using Backpack EMR, or Lori, you were going off mute too. You're welcome to speak as well.
I mean, I'm happy to do a commercial for Lori if you'd like to. In the advantage that we had when we started, I started very unsure of how to start a primary care clinic, and I started with an EMR system. So I didn't start on paper. And so I came in pretty novice as to how to start, and I started with Lori right away. And she and I worked together a lot, and she has tolerated me for 4 years, I say, but we've grown a lot together. So there were some growing pains, but I think, and Lori can correct me at this point, I think I was was kind of one of the pioneers that put it into a full-time primary care clinic on the ground. And so once we started to like add more and more and more and more and more, like this problem is not going away. We have a huge amount of patients now, and we can't just like continue to put them in different campaigns. Like they're going to keep coming. So we've learned a lot with them. My biggest thing for her, they're very simple. They're continuing to add amazing features to it, and it's very workable for a rural area primary care clinic that has very inconsistent internet and even electricity if needed. We obviously have solar, and we can continue electricity throughout the day, but all of those things were very important to me when I started, and I'm very, very happy with what we have accomplished, what she's accomplished. I can't take credit for any of this, what she's accomplished, and where they're going in the future.
Awesome. Thanks. You have helped a lot too. So it was a joint effort, let me tell you. Thank you.
Is it okay if I also chime in from Soaring Unlimited? This is Pastor Laura Elliott. We have just started in the last 2 weeks using the Backpack EMR. Lori has been working with us since probably the middle of last year to get everything going. And a lot of the things that everyone's already said, I would echo in terms of the experience of it. But we've had a really good experience with Lori in the sense that she's been willing to do pretty much anything at any time that we needed her to help get our staff on board. And one of the things that it is beneficial to us, some of you guys who come on the Haiti Health Network on a routine basis may recall that we just opened a birth center. And so we're trying to get that started from scratch with putting the information in. It doesn't have a history of, handwritten, but our existing regular clinic does. And so having the staff have to switch from that. And probably because we just started 2 weeks ago, nobody has pointed out to me yet from the staff that this is not going to coincide with what MSPP expects. So I think y'all have given me a good heads up. I need to ask about that and find out what kind of issues that's going to create when they report to them. But Brooke is the person on our board who's on this call who has worked with the modules because she's a medical professional. I'm not. I'm the director of the agency, but that's not my background. Brooke, did you want to talk to them about how you've helped work with Lori on the modules specifically that you're developing for the lab and so forth?
Right, right. Well, first of all, Lori has done an excellent job training our staff. We had multiple trainings, and we had a couple of people on the staff that really caught on quickly, so they've been able to help as well. And so that has been a challenge because we've done it all over Zoom and with translator, and it was a real challenge, but it was successful. The team seems to have embraced it and I'm anxious to see how their first 2 weeks have turned out and what kind of barriers or problems or issues that they might have had. I think we're gonna have to have a meeting pretty soon just to kind of get a debrief going. But Lori and I have been working on the lab module. They're using the one that's with it now, but we wanted to make it specific to what we're doing at our clinic. And so the nice thing is that Lori can customize it to fit our needs and to keep it as simple as possible with the results. And there's some very nice drop down boxes with results that are going to be there. And we've really tried to work through that. And that's been kind of a challenge, but it's been really great working with Lori. And what I appreciate so much is her willingness to customize it and work with us to keep it as simple as we can and yet accurate and efficient. I think one of the biggest challenges is going to be using the queues, putting the patient back into the queue and, the clinic flow. And I'm going to be anxious to see how that is turning out. But as far as the enthusiasm for using the EMR, our staff has really embraced it. Most of them, not all of them, but most of them have really embraced the whole thing. And I really appreciate all of Lori's patience and effort in that area. So
that's great. Thanks for sharing all that. I kind of have 2 more questions that I was thinking about, and we're running late on time, but we can stay later if people want to. No, you're fine. Everyone's questions are good. I was going to ask, I wanted to touch base a little bit more about what Meg brought up about the MSPP reporting, and just ask the other people on the call how you have addressed it or how you are thinking about addressing it as you go into it. Rasha, I think you mentioned that your system had some way to integrate, and I might have heard that wrong, so I don't know. I wanted to ask about that.
I created the MSPP report, so the system will generate the report for you, and I just transcribe it onto MSPP paper.
And they accept that?
Oh, I fill up their paper. Yeah, but
okay, I see.
System I've created so it answers all the questions and it generates the data.
Okay. And I think that's what you're looking to do too, right, Meg?
I mean, ideally, we would have DHIS too syncing, so we don't have to fill out any forms. It just automatically.
Yeah, wouldn't that be ideal? Yeah.
Yeah,
one day.
Yeah, because it's just a lot of manpower, like the resource. Everyone sees so many patients. Like you just need a lot of people doing that manual labor. Where if it could be digital, then it would just be one person versus 10 data clerks that we have. So yeah, it's a struggle, but I think it's many years. They're many years away from that. So also on my priority list, like it's a reality, but it's not a high priority because until MSPP is ready to accept it, like I don't think we're going to spend a lot of time on trying to develop reports when we could be improving our dental plugin or our wound care plugin and things like that.
Yeah, and both C2C and Hope for Haiti do definitely high volumes, very high volumes, I know. Dr. Francois, I saw you had your hand up. Did you have a question or a comment?
Sure, thank you, Barbara. I first apologize for being late, but I want to seize this opportunity to ask a question. I represent the clinic, a clinic at Lembe called Clinique d'Urgence Accès Santé. I have with me in this meeting, Dr. Dwight Saint-Fleur. I don't know if he already touched base on this question, but I will go straight forward to ask you, how can you orient our clinic to get this service, because our patient flow is growing up We have actually about 600 to 1,000 patients per month. And we really go through a challenge to manage the data and to optimize the care that we want to provide in the community. So we practically have a good infrastructure in terms of electricity, and in terms of space, we are limited, but really we want to be connected to the technicians and see, work on a plan so that in the upcoming months, we can enjoy the benefit of this system. What it takes, how can we get ready to be on board? If you can please give me a briefing about it.
Yeah, well, I'll let the people on the call speak, but we have, I think, 4 EMRs represented here, right? Am I counting right? Yeah, 4. And there's obviously many more than what's just available here. But I was thinking what might be a good idea, Rachel, and all of y'all that shared, is maybe put together a little list of what was presented and how to get in contact, maybe a few features, highlights, and maybe some, I think, Brooke, your question was excellent as to what is the size of the clinic, because I think that can go into consideration to what you select and why you select it. And so, and even patient demographics like pediatrics in Lindsay's case. So maybe we put together a little chart just of these 4 that were here today that we can then circulate with, you know, Dr. St. Fleur and Dr. Francois and others. I mean, we'll share it with the whole network to help direct people. And then we could, you know, we could even, if y'all are okay with it, put your emails for questions. I'm not going to, we can answer that offline. I don't want to bombard you guys with questions. And I don't think it would become that, but just to be aware. But that might be a way where you can compare then, Dr. Francois, the different 4 that are represented here today. And another question that I'll just end with, and maybe it's something we end up we consider adding on this document, is the price range and the cost of what it's taken to get it up and running. And I know that there's hardware costs, there's the software, there's the development costs. And so we might want to include those as well that we can share, and not exact numbers, but even ranges can be helpful. You know, the hardware costs between this and this for this standard size equipment, you know, clinic, the development time was this much per hour. I don't even know how they all do it, but different ways of costs, cost of implementation. So that would help someone, I would think, like Dr. Francois and Dr. St. Fleur make good decisions for their facilities.
If you're open to it, I also created a list of questions that you should ask EMR providers if you wanted to include that too. I can just show you what it looks like and you can decide if you want to throw it on there. But it was just this list of questions like connectivity, how does it work, equipment, you know, make sure you know, associate those, what kind of training, you know, company availability or ability, all the different data protection questions to ask, the features. So I can send you this list, Barbara or Rachel, if you wanted to add this, just so people can, maybe there's some questions on here they didn't think of and they can ask those EMR providers.
Yeah, and I think you guys, like Meg and all of y'all, Rachel, everyone touched on it. Lindsay touched on all these things that they thought of that were really important to them. And I saw on that sheet, I saw some of them that you guys said, like highlighted, that every clinic and every provider might have some that are really important to them, like 100% it has to do this. And then another person be like, I can take that or leave that. But you got to be able to think through all the options and then decide what's best for your clinic.
Cool.
Thank you, Barbara and Lori, for your elements of response. And I will be looking forward for maybe an email to connect me with.
Yes, we will follow up with
right,
you.
Thank you. Thank you.
Barbara, this is Pastor Laura again. I have one other quick thing. I know it's 3 o'clock, but one thing that I'm interested in, I don't know if you remember, it's so long ago now and so much has happened, but there was an in-person event incapacitation in 2019, I think, before the pandemic and before the political unrest got so bad, in which the Haiti Health Network had some speakers at the hotel, the Satima. And
Yep.
one of the discussions was about networking among the medical facilities electronically. I don't know if there's, you know, anything like that even close to being on the horizon after everything we've been through in Haiti. But for the future, I would just throw that out there. I think, if I understand correctly, there are often networks like that in the US. And perhaps even most medical facilities have the capability to share information if necessary. But it's just a thought related to, you know, working together, partnering, collaborating, and whether there's potential for that with electronic record keeping.
Ooh, that's a loaded question.
Well, it's
Like,
probably a very loaded question considering that we have different vendors on the call. I realize that. But I
Yeah.
just think it's worth, you know, tucking in our pocket for the future, maybe.
Yeah, no, I think I long for the day when we can have another another conference like that in different parts of the Haiti. I could already plan them out in my mind where we can sit and
Yes.
discuss these topics in greater detail. I think right now I would have to say it's probably been tabled, at least from what I've heard since that last discussion, but definitely it would be a great idea, at least for some of the bigger reference hospitals, to be able to communicate with the rural clinics and transfer patients. That would be so wonderful. There
Yeah,
are
that's
few
exactly what
systems
we're,
that were piloted in the EMR sector. I'll have to, not in the EMR, in the EMS sector that did that, and I'll have to kind of
Okay.
resurrect that and see what's happened with those.
well, that's kind of exactly what we're into with our new birth center. We've already had to refer a couple of emergency situations that were beyond the scope of midwifery, and you know, it's worked smoothly the way we've done it, but to be able to share information electronically would make that better when we refer to a large hospital.
Yes, absolutely. That would be wonderful. Dr. Francois, did you have another question? Anybody else have another question before we wrap up?
No, I don't. Thank you.
All right, so we did record this, so we'll share out the recording that can be watched again or shared out with others. We will definitely send it to everybody that registered for the webinar. And we'll also put together that little chart of the EMRs that were represented here on this call and share that out with everybody that registered as well. All right, well, thank you all for being here. Like I said, I'm so happy to have had a discussion that's about something normal and just daily operations and not something super sad. So thank you all. Thank you, Meg, for thinking of this topic. Thank you all for participating. I'm really glad to look to this today. All right, everybody have a great day.
Thanks.
Thank you.
Bye-bye.
Bye.